You're listening to the Doctor Is In podcast. This is the show where you get the best tips, tricks, and nutritional hacks to help you and your family get healthier. You'll also hear what works and what doesn't work so you don't have to waste your time and money. All right, let's get started.
Hello, this is the Doctors In podcast, and this is episode 135. I'm Dr. Martin Jr.
And I'm Dr. Martin Sr.
And we want to thank you for joining us today. On today's episode, we're going to talk about joint pain, which very common, and specifically we're going to be talking about the type of joint pain that is not necessarily caused from an injury. Now, the stuff we're going to talk about at the end of this podcast about stuff that you can take to help joint pain will definitely apply to, it doesn't matter if you've injured your joints, but we want to talk about some surprising causes of joint pain, and then we'll talk about joint pain in general, and then we'll kind of end off this podcast by talking about some of the natural things that we recommend or what you can do from a natural standpoint. Because quite frankly, you know, we've talked about this in previous episodes. The over-the-counter painkillers or the non-steroidal anti-inflammatories that people eat like candy every day are not without consequence, right? We know as research is coming out, they cause some serious issues in some people and not so serious issues right away, but down the road they cause some serious issues.
Yeah, one of the leading causes of toxic events that people go to the hospital for, and liver and kidney, is caused by non-steroidal anti-inflammatories like Tylenol and Advil. They're not, like you said, not without consequence. There's a lot of people that have elevated liver enzymes, and they start to get damage to their major organs like the liver and kidneys because of pain. And you can understand, right? Like when we talk about joint pain, I had a patient in today, and I said her cortisol was very high. And she said, well, I'm not stressed. And I said, well, that's surprising because your cortisol is pretty high. I said, but, you know, you might not feel like you're stressed internally, but she was in a lot of pain.
Yeah.
So
the body was stressed.
Yeah, the body was stressed, and she wasn't sleeping because of pain. And the quality of life in people are just so hampered with chronic pain, right? Like, I mean, when you look at, I mean, we can go off on another tangent, but if you look at one of the biggest problems that has affected North America is this opioid crisis, right? And where did that come out of? That came out of people that had pain, chronic pain, and opioids were, that's going to be the greatest thing since sliced bread, right?
Yeah,
in terms of,
they solved one problem and created another massive one.
And, you know, people got hooked, right? And then, I mean, that's a whole other issue, but but a lot of it did start with joint pain, right? They're just chronic joint pain.
Well, I spent a lot of years treating sports injuries and treating injuries, and I was always amazed that, you know, when somebody had long-standing pain, they'd come in, and I would kind of read through their forms, and they're taking a painkiller of some kind, and then after talking to them for a little bit, they've been taking these painkillers pretty much every day for years, almost decade, you know, and it's like, it's amazing that their stomach hasn't bled out. It's just, you can't, we're not meant to do that. And I used to use the analogy all the time with patients that, you know, imagine you're driving in your car and your engine starts making some funny noises, and you just decide to turn up the radio, and problem solved, right? You can't hear the engine noise anymore. And that's kind of what a painkiller does. Doesn't fix the problem. A lot of people are under the impression as well that Advil fixes stuff because it's an anti-inflammatory, right? It's an anti-inflammatory. But it's a painkiller, and it is a non-steroidal anti-inflammatory. However, it doesn't really fix it. Advil doesn't fix really anything.
No, it masks it, right?
Yeah, exactly.
And you can understand. You get a headache or whatever. And
and there are some times when you want to turn the radio up because the engine noise driving you crazy, and we understand that fully. Mm-hmm. The problem is like anything else, you have to ask yourself, if you're repeatedly using these things, you know, what's going on, and is there a better approach? Is there a better, it's time to fix the problem, right? Here and there, you know, whatever, everybody, you know, we live on planet Earth, and every once in a while, like, people get headaches or they're sore, they hurt themselves, and okay, that's fine. But
for a few days, you want some management until you can fix the issue, right?
Yeah, months later, you're still taking a daily painkiller. There's a problem going on that needs to be addressed. And we looked at a study a few episodes back on non-antibiotic drugs that kill your microbiome, right? Mm-hmm. And obviously, a lot of the non-steroidal anti-inflammatories, so a lot of the over-the-counter drugs that people take kill your good bacteria, which we're starting to understand. Science is starting to catch up on what that means for the rest of your body, which leads us to two very common causes of joint pain that have nothing to do with an injury. And they are, of course, well, let's reverse engineer this because that's what we like to do, right? So it really doesn't matter what the source of the problem is, because if you go one step removed from pain, in a sense, there's inflammation present, right? It doesn't matter if you twisted your ankle or there's something deeper going on that's causing your pain, there's inflammation present, right? Inflammation, which is why these over-the-counter anti-inflammatory stuff, they lower inflammation. They also cut the pain nerve, in a sense. That's not technical, but let's just, for imaginary purposes, they just kind of clip that pain nerve for a while. And, life goes on. But at some point, there's inflammation there that's causing the pain. However, as you and I say over and over again, inflammation doesn't just, your body's not David Copperfield, right? It doesn't just magically appear for no reason. That's not how it works. There has to be a cause and effect. The inflammation is the effect. The inflammation can be the cause of your pain, but it's not the cause. It's the effect of something else, right? There's something causing that inflammation. Yep. And two big causes of inflammation, as it's related to joint pain, that you and I see or talk about a fair amount, are leaky gut syndrome and high circulating insulin. So let's talk about those individually, and then we'll kind of talk about how you can fix the problem. Now, again, let's talk about leaky gut for a few minutes. We've talked a lot about leaky gut over the last little while.
We're very simple people,
Yeah, and
we talk about the same things, but you want to simplify your body. This is such a wonderful thing, is to know, okay, I mean, that can really, 80% of anything that goes on in your body, if not higher, is coming out of your gut.
Well, they've been saying that for a long time, right? And now they're really starting to understand why that is because there's always been this unknown connection. Research used to call it the gut-joint axis, right? It seems to be a connection between your gut and your joints, and now we know that it has to do with your microbiome. Mm-hmm. It has to do with your bacteria content. And if your microbiome isn't unhealthy, then there's a chance that your joints will pay the price for that. Now, what's interesting, and this is what makes it fascinating, is that some people, when their microbiome isn't healthy, they may end up with dementia. Some people may end up with skin conditions. Some people may end up with, the list
depression.
Depression. The list goes on and on. Some people may end up with a combination of all those things.
Autoimmune.
And then exactly. And some people may end up with some joint pain as a result of it. And it's just like, it's one of those things that leaky gut, a couple podcasts ago, 2 episodes ago, we talked about the 4 stages between health and disease. And, we wrote a book called Are You Built for Cancer? And one of the first things that happens as you move towards disease is leaky gut, right? A change in your microbiome, and then leaky gut happens. And that's one of the first steps that happen, because that increases free radical damage, it increases inflammation, it increases the toxicity of your body. It's just like one of those things that can affect everything. But there are a lot of people walking around today with joint pain because they have an unhealthy gut. It sounds like sci-fi. Yeah. It does. It sounds like a sci-fi. It doesn't seem to make sense. However, your gut and your joints, there's a direct connection between the health of your gut and the health of your joints. And here's what makes it even more frustrating. A majority of the people with leaky gut have no digestive symptoms whatsoever. So you say, well, you have a problem in your gut, and they're like, wow, my gut's like cast iron. I have no problems whatsoever. I
can eat anything I want. And
I have
my
no
plumbing
indigestion.
is good. Go to the bathroom every day. And
so it's like, then they really think you're a snake oilsman when you're trying to pull something over their eyes. Like, well, how can my gut be the problem when I don't have any gut symptoms? It's like, yeah, your gut is the problem because you do have a gut symptom, but that happens to be your joints, right? It's just not a traditional gut symptom. It's still a gut symptom nonetheless.
Yeah.
We look at the health of the joints. If you want a healthy joints as well, you need healthy gut, among other things. But that's a very important piece of the puzzle, right?
Yeah, it's a foundational thing. And again, people come out of the gate, they, and this is much more common today, birth by C-section. The doctor said, hey, you need a C-section, and baby comes out. Well, they don't come through that normal canal. They don't get the bacteria that they ordinarily would get. And it's part of the reason that can change a baby's microbiome.
Yeah, or they're fed high. Go look at the first ingredient on baby formula. Yeah. It's junk.
Yeah.
So they're fed that, and we know
now
as
you
an
got
adult,
yeast, you got fungus, you got a Candida albicans, you got all these things that come into the bloodstream, and you don't die on the spot. But the problem is that it changes things in your body. It develops over a period of time, creates inflammation. The body's trying to respond to the toxins that are in your body. The ambulance comes running out, and oftentimes it's linked to your synovial fluid in your joints, or starts attacking. You have an overgrowth of Candida. And again, we see it all the time in the office. Incredible. Patients are looking at me. Well, the doc says I got arthritis. Well,
yeah, who doesn't? That's the thing.
Yeah, you might have some wear and tear in your joint, but why do you have that?
Yeah. Where did that? Did you play football?
Yeah.
Were you squatting a lot of weight? Were you there are, I used to treat a lot of repetitive injuries. And, one of the hardest things on the body is repetition, right? There's no question. Repetition is very hard on the joints, very hard. And repetition typically will wear down, will cause more tendon issues or ligament issues. But there are some wear and tear. But, research is showing now for the average person with arthritis without an injury, it's not actually, they used to call them wear and tear injuries, but now they actually call them lack of wear and tear, right? Because the body has a principle, if you don't use it, you lose it. And that goes for weight-bearing joints. They call them weight-bearing joints because they're meant to bear weight.
Yeah.
Unfortunately, one of the worst things that can happen is when somebody starts to get sore, in a sense, and then they stop weight-bearing. So a weight-bearing joint is no longer has its purpose. A weight-bearing joint is not meant to be...
And then ankylosis, right? It starts stiffening up. And
that's right. And the whole mechanism just starts to break down because it's no longer serving a purpose, right? If I was... it's funny. Disney has done a great job of kind of personifying animals, right? Like, every animal has a character and a personality, and Disney makes a ton of movies on where these animals are basically humans. Well, think of the joints basically the same way. Think of your joint. Your weight-bearing joints are sad when they're not being used, right? Their purpose is to get out there and do stuff, and when you're not doing that, they get sad and, they break down and everything that happens. But the bottom line is we're seeing an epidemic of arthritis or joint issues that are non-injury related. You see it. A lot of people are in pain, right? Pain is systemic, chronic, or it can also isolate itself in some joints. A lot of times it's what ends up happening is that I used to see this again, right? Like somebody has swelling in the ankle. Well, because it's far away from the heart, blood can get down there easily, but it can't get back after. The mechanisms to bring it back doesn't work as well as it used to. So you get the pooling in the ankles, you get all that kind of stuff. But the bottom line is that if you've got chronic joint pain and, you haven't done anything really to warrant that chronic joint pain.
It's not age.
No, it's not age. And that's a
because a lot of people say, I'm getting older. How old are you? 50.
Yeah.
Like you're still a pup, man. Really, your joints are not supposed to wear out when you're 50 years old.
The gut is a big thing, and that's something that you should have assessed. That's something that you should be looking at
get your
as
biomarkers done.
And then the second big reason why people have joint pain, and I would probably put this, it's hard to rank them. They're pretty even.
Yeah. And they're connected, too.
And they're connected very much so because they all kind of lead to, which is high circulating insulin, right? And again, a lot of people
You've never mentioned that before.
Yeah.
I'm surprised that you're bringing that up.
It's kind of funny, again, that having high circulating insulin can directly result in joint pain. And there's actually multiple ways that can happen, right? Mm-hmm. One is you think of the effect it has, like the joints almost, caramelize, right? They almost start to, the AGE, like the byproducts, right?
Yeah,
they start
glycation.
those glycations. So what happens is the joint starts to basically destroy itself. And orthopedic surgeons are describing this now more and more. They go into a shoulder, they go into a knee, and the joint has completely caramelized, like it's just eaten itself out, basically, because of sugars, in a sense, right? The byproducts of all that's happening. So that's one thing.
A lot of necrosis there and stuff like that. Eh?
That's one way for sure. But we also know that high circulating insulin is very inflammatory, right? If you have high circulating insulin, you're full of inflammation. And you and I have talked about this before, and it's something that's always fascinated us, and it's one of the principles behind our biomarker testing, is how inflammation has become the new fever, right? We've talked about this before. And for those who aren't familiar what we mean by that, it used to be that all the top killers were living things, right? Bacteria, viruses. I mean, not too long ago, prior to 1950, a lot of the top killers were these infections, these viral infections or bacterial infections. And you would know you had one of these things when you have a fever, because your body recognizes these foreign invaders and your body charges its immune system. And one of the ways it does that is by giving you a fever, right? Fever is not a bad thing. Fever means that your body is doing its job. It's recognized something's wrong, and it's trying to charge its white blood cells to go and fix the problem.
Yep.
And that's how things used to work. Now, if you go and look at the top killers, they're no longer living
They're
things.
metabolic.
They're metabolic. And so fever is no longer an indicator of illness like it used to be. Now, inflammation is that new indicator. And the reason for that is because the things that are causing a lot of these issues are not alive. They're not bacteria, right? They're chemicals. Your immune system does not react the same way at all to a chemical as it does to a foreign living bacteria. So inflammation has become the new fever. Inflammation is an indication that something is going on the inside. And sometimes it can be very specific. Sometimes it can be very generalized, right? Which is why last week's episode we talked about one of the tests that we think people should ask their doctor about is that C-reactive protein.
Mm-hmm.
But nonetheless, high circulating insulin is a major cause.
And that's a food hormone.
And it's
food.
Yes, which is why a lot of people will tell you that once they start to eat a certain way and do certain things, they're like, hey, is it possible that my joints don't hurt like they used to? Because that's a byproduct that they notice. They're like, they feel better. That's one of the things we hear a ton about is how much better people's joints feel, even though they didn't come and see you for joint pain.
Yeah.
So that high circulating insulin is that one. So again, you got leaky gut, so you have a microbiome issue, and then you have high circulating insulin. Now,
yeah, just one thing. I just want to say one little thing on that, because we talked about glycation and what you get. It just oxidizes. It's like it can destroy the joint, and it destroys your cells. But the other one is uric acid, and that's a byproduct of high circulating insulin, right? And the nice thing about our test at the office, the biomarker, we look for uric acid, right? Because it's very common. And people come in and they don't have, no, I didn't hurt myself, but yeah, my joints are sore. Yeah, they are, I got a lot of pain on and I said, well, your uric acid levels are high. Well, if your uric acid levels are high, your insulin is high. You got high insulin, high circulating insulin, right? And that's one of the markers that we look for. And those little crystals, uric acid, love joints. They love, as they circulate into your bloodstream, they love your, unexplained foot pain, knee pain, hand. A lot of people, their hands are sore, stiff, painful, and it's uric acid caused by food, sugars.
Yeah, and specifically, I remember you talking about this a while ago. Uric acid, for somebody who's really suffering with gout or uric acid crystals, their main villain is fructose. Fructose seems to have a special affinity for creating uric acid crystals. So if you're listening and you're suffering from issues with uric acid like gout and
kidney stones,
you definitely want to minimize your fructose, especially your high fructose corn syrup. That should be removed altogether. But even eating a lot of fruit in this case can irritate it, no question. Yeah. So, all right, those are the two kind of causes. I mean, there are other things as well that are in there, like excessive free radical damage and stuff like that. But those are two main reasons why inflammation is elevated and then people end up with sore joints. Now, let's finish off by talking about some of the natural things that people can do to fix it. So, obviously, if they have a problem with leaky gut, then you want to fix that with probiotics.
Absolutely.
You want to fix that with digestive enzymes. You have to address the inflammation in the short term, and then you have to fix the gut in the long term. If they got high circulating insulin, they want to get that insulin down, remove crappy carbs, eat below your carb tolerance. Those are things that we talked about in previous episodes. But let's talk about a few natural anti-inflammatory. Not only are they anti-inflammatories, but they also promote healing. And that's a big difference between a synthetic versus a natural, right? They promote healing as well, and they also help lower inflammation. So let's start by talking about curcumin. A lot of people know curcumin. A lot of people know turmeric. And a lot of people get those two confused, right? Because it is a thing. It's like, are they the same? Are they different? What's the difference between them? I take turmeric. Do I need to take curcumin? And it's a great question because, both of them are well known. And the best way to think about those two is that, we use the analogy of an orange, for example, right? If you want to get vitamin C, you can eat an orange. The orange contains vitamin C. And that's how you have to look at turmeric. Turmeric is like an orange in a sense where it contains curcumin. And curcumin really is that active compound or that active component that is really fantastic for a lot of inflammatory purposes. Yeah. So
it gives the pigment, right, to the turmeric, right? It gives the yellow color, right?
Yeah, and that's the active, in a sense, ingredient. There are some other things in turmeric in itself that are good for you, no question. But when it comes to a therapeutic, you want curcumin, and turmeric contains curcumin, which is why we'll use, for example, just pure curcumin. Now, before we talk about some of the benefits, let's talk about some of the issues with curcumin, because this is another problem, really. Curcumin, research has shown this, is very hard to absorb. It used to be that you had to consume a ton of curcumin just to get a minimal dosage because your body it's not highly bioavailable.
Yep.
You just don't get it, right? So there are a few tricks that you can do to help with that. Now, we use a very specific type of curcumin. It's a 30-to-1 ratio, and we add black pepper because, black pepper has been shown to increase curcumin absorption almost 2,000%. So we add a few things in there to really help you get the amount of curcumin that you need. Another issue is that curcumin is fat soluble. So it makes sense to take it with food, right? If you're taking curcumin, you want to take it with food because it's a fat soluble.
You mean I can take it with my peanut butter?
Well, that's actually one of the great things. Now, we would actually highly recommend taking a curcumin with DHA because DHA is tremendous for inflammation. On its own, it's fantastic for inflammation. We love it for inflammation. But when you combine DHA and curcumin, research has shown they're like a dynamic duo. They help each other target. Curcumin increases the effect DHA has on your brain and vice versa, right? Yeah. DHA helps you absorb your curcumin, and curcumin helps you get more power from your DHA.
And a huge COX inhibitor, right, is putting those two together. And that really, really reduces inflammation big time.
So we're huge fans of curcumin, and especially taken our right, because there's a lot of, like anything else, there's a lot of not good curcumins on the market. They're cheap. However, a good curcumin with some black pepper and then combined with some fat, especially DHA, man, that's like a superpower, right? That's an awesome way. And there's a lot of research behind curcumin. Curcumin.
Well, you've seen the new studies on curcumin and cancer?
Yeah, they're it's very exciting.
It really is. What it does to genetically to help fight cancer, and of course we love it for inflammatory conditions like Alzheimer's and dementia, what it does to the brain combined with the DHA. And I just got a real good feeling because we have such a good one, that not only we're already seeing results with the joints but there's going to be legion of results. Like I just know, like I was telling a patient this morning that this thing for your brain, because she asked me, like, what do you, like, I want to know what you're doing. I said, well, I tell you, I read all the research. So DHA and curcumin, what a combo for, almost everything you can think of that's inflammatory. And, like you say, what's the new killer today? Inflammation, of course, caused by...
And curcumin doesn't care where the inflammation
it
originated from, right? It's an inflammation squasher. It cools it off. Now, I have a collection of studies. I do read a lot of studies, and I keep a collection of studies. And so I have a collection of studies, for example, the benefits of curcumin on anti-aging. Really good for anti-aging. Very good for allergies, Alzheimer's, brain, cancer, depression, heart, insulin resistance, of course, your joints. Good for your kidneys. It's very good. A lot of research on curcumin and ulcerative colitis. Really, really good for inflammatory bowel disorders. I mean, on and on and on, right?
So, well, when they were saying in India, I was reading a study the other day, they have 50% less depression than North Americans suffer with. So, again, is that the link that they're eating that spice all the time, right? It's a main part. It's a staple in India, right? That turmeric. And anyway, yeah, but just fantastic.
All right, so we talked about curcumin. We're out of time here. So we talked about curcumin. We talked about DHA. Those are two that we really like for inflammation. And then another one that we like for inflammation is pine bark extract, which is found in our Navitol. I mean, not only is it a great anti-inflammatory, it's a COX inhibitor, but it's also fantastic for free radical damage, promotes blood flow. Think of all the amount of blood that goes around a joint and delivers all the nutrients. Better blood flow, healthier joints. Everything around the joint is healthier. Anything that can improve blood flow, which that's one of the benefits of pine bark extract. Keeps the blood vessels healthier, improves blood flow, all those kind of things, right? So we really like those three things. We also have another thing that we use in our clinic as well, depending on the case, which is our inflammation formula. And that's a combinational stuff like green-lipped mussel extract and some other real things.
Curcumin.
It has curcumin in there as well. Not as much, nowhere near as much as our actual curcumin, upgraded curcumin. But those are kind of the three things that we like. But again, if you got leaky gut, you got to fix that. If you got high circulating insulin, you got to lower your insulin as well. And that's kind of where we would start when it comes to approaching joint pain from a natural aspect. And then lastly, you can't rule out strength training. Lifting weights is tremendous for joint health. So good for joints. A lot of people shy away. They think, I got sore joints, I shouldn't be lifting weights. Things grow from being stressed a bit, right? The joints, everything strengthens around it, so you definitely want to consider that as well. Well, we're out of time. We want to thank you for listening to this episode. If you have any questions, you can email us at info@martinclinic.com. Go to our website. You can, we got live chat on our website. You can ask some questions there. If you're not a newsletter subscriber, sign up for our newsletters at martinclinic.com. And then every Thursday morning, you can watch you do a Facebook Live. A lot of people join you, a lot of questions.
Yep, that's the way I've always have a lot of fun.
A lot of fun doing that. So it's every Thursday morning, and I think around
8:30.
8:30. So every Thursday morning, 8:30. So again, thank you for listening. Have a great day.